lunges and you just can't quite seem to stand back up? Have you ever been doing a spectacular rendition of chopsticks and felt that your knuckles are locked into place? Welcome to 10 Minutes. Today, we'd like to investigate a particular drug called Vioxx. In this special investigative report, we'd like to explore just what went wrong with this used-to-be miracle drug for relieving the same symptoms and pains of osteoarthritis, rheumatoid arthritis, primary dysmenorrhea, and acute migraines or headaches. Look at the story of Peter and Lindsay Doe, two unsuspecting victims of the pharmaceutical drug lords. Let's take a look at our hero.
You want some coffee?
Yes, please.
All right, I'll get it. Oh, my knee!
That knee at you again.
Yes, son, it's aching again.
I'm gonna get Dr. Turn on the phone. We need to get this sorted out.
I guess.
Hello, Dr. Turn? Hi. My husband, Peter Doe, he's been having trouble with his knee for quite some time. Can't do hardly anything around the house. Can we get in? Oh, you have an opening today. 3 o'clock. That's perfect. See you then.
All right, Mrs. Doe, I'll see Mr. Doe at 3. I wonder if I should treat them with Vioxx. Let's look up stuff on Wikipedia.
Hello, Dr. Chen.
Hey, Nathan. I was actually wondering about this new drug Vioxx. I was interested if you could tell me more information about it.
Yeah, of course. Vioxx is used for the treatment of pain and inflammation caused by various forms of arthritis. It was approved in the FDA in 1999. It was seen as a solution to the detrimental effects of the NSAIDs, the previous generation of drugs, which were non-steroidal anti-inflammatory drugs that basically caused gastrointestinal inflammation and various stomach issues.
Wow, thanks. That sounds exactly what I need from my patients. Appreciate the information.
No problem, Dr. Chen. Don't hesitate to call anytime. Thanks.
I won't.
Hi, Peter.
Hi, Dr. Turn.
Hi, Lindsay. How are you?
Not too good. I've been experiencing some knee pain.
Oh, really? When did it start to hurt?
Well, I'd say it all started about 2 years ago. I experienced it mostly when I've been sitting down for a while, watching a movie. My knees start to feel really stiff. And also sometimes I feel it when I've been typing on the computer for a while because my wrists start to ache or my fingers don't move no more.
Oh, really? Sounds like a classic case of rheumatoid arthritis. But I actually talked to a pharmaceutical representative about Vioxx, and I think that'd be the perfect drug for you. We'll put you on it for about 6 months, and if you feel good, then we'll keep at it.
Gee, Dr. Turn, that sounds mighty fine.
Now hold on here. Are there any side effects to this new drug?
Well, you're 48 and you're pretty healthy, and you have no prior cardiovascular complications, so I think you should be fine.
Okay.
Sounds good.
Thank you.
Thank you, Dr. Turn.
The scene you've just witnessed took place in 1999. What Dr. Chern and the Doe family couldn't predict was that this drug would be removed from the market in 2004. On September 30th of this year, Merck & Company withdrew Vioxx after clinical trials demonstrated an increased risk for heart attack and stroke. Here, I'll quote the FDA Commissioner, Dr. Lester M. Crawford. Although the risk that an individual patient would have a heart attack or stroke related to Vioxx is very small, the study that was halted suggests that, overall, patients taking the drug chronically face twice the risk of heart attack compared to patients receiving the placebo. Because Mr. Doe was taking this drug over the course of 3 years before realizing its malignant side effects, he fell into this unfortunate group of patients with increased risk of heart disease. 3 years later, Mr. Doe died at the age of 55.
My sweet Peter. Oh.
Dr. Chern, can you explain to me what went wrong in this case?
Absolutely. Mr. Doe actually had a myocardial infarction, also known as a heart attack. His heart attack was actually due to thrombosis of the coronary artery.
Thrombosis. Could you put that into layman's terms?
Sure. A thrombosis is basically a clot that happens at the blockage point of the vessel. So, for Mr. Doe, the clot formed in his heart and it blocked a necessary blood that would supply his cardiac tissue to pump necessary blood to the rest of his body. So it could potentially lead to death.
Of that section of his heart.
Yes, the clot happened section of his heart, and then restricted blood flow there.
Excellent. Thank you very much for your time.
No problem. Thank
Now, let's go to a press conference with Miss Morley to see what Merck & Company has to say about this issue.
Vioxx, my husband!
Yes.
Miss Morley, could you explain the physiology behind the increased risk of heart failure among Vioxx users?
Of course. First of all, it's very unfortunate the side effects of Vioxx were not discovered until far too late for many of our Vioxx customers. Vioxx works by inhibiting the COX-2 enzyme, which is responsible for prostaglandin production.
Yeah. Could you elaborate?
Of course, prostaglandins are responsible for pain and inflammation. By inhibiting their production, pain and inflammation are relieved in a patient. This is the intended effect for patients in Mr. Doe's case.
So, how did this lead to Mr. Doe's death?
Well, one particular prostaglandin, prostacyclin, protects against outward thrombosis, or blood clots. When this molecule is not produced, the risk of blood clotting is increased as platelet aggregation forms, and the tendency towards clumping eventually forms a fatal blood clot.
So,
Well, this can cause heart attack or stroke in certain patients.
Boo!
Thank you very much. Thank you very much.
Mrs. Doe, I'm so sorry for your loss. How are you feeling?
I can't believe a drug like this could be released to the public. My husband was in perfect condition before he started taking Vioxx. They need to do more research on what this could do to people.
Again, I just want to say that I'm so sorry, and my heart goes out to you, as well as the other 60,000 people that were affected by this drug. Thank you again, Mrs. Doe, for watching another episode of 10 Minutes. We like to keep you informed. On our next show, we will tell you about Nettie, the water skiing squirrel. Stay tuned.